Did you know acne is the most common skin disease? People of all races and ages get acne, but it is most common in teenagers and young adults. An estimated 80% of all people between the ages of 11 and 30 have acne outbreaks at some point in their life. But here is the kicker: not treating it can actually make things worse. Alison is here from Bluegrass Medical Aesthetics to talk us through the process on how to help us. Welcome to the show, my friend.
Thank you.
Okay, acne, I know, can be a debilitating disease or issue. Is it a disease, a skin disease?
Really, it's a little bit of both. It can be both, yes.
And it is really, I know people who have acne. I had it as a young teenager. I had, back in the day, some very harsh chemical peels. It's come a long way when it comes to treating now. Thank you, Boo. But I understand, because you're actually feeling a little insecure.
Yes.
And as an adult, you're even more insecure about it. Let's talk about acne in adults.
Yes, your skin really changes every 7 years. So not everybody has it as a teen. They kind of have it as an adult now.
I didn't think about
or
that.
vice versa. So it can continue and just kind of come out of nowhere. But really, there's four main causes of acne. It's junk food, it's your environment, it's also hormones and stress. So those are really the four main causes.
Okay, and people do get acne and pimples confused.
Yes.
Okay.
So there's different forms of acne. Some of it is surface acne, some of it is cystic acne. So sometimes they go deeper than others.
Okay, well, let's get into what we can do to begin with. What's the first step?
To come see me.
I knew you were going to say that.
So coming to see me at Bluegrass Medical Aesthetics is just a great route to go first and foremost, because I need to see someone's face.
Yeah.
I need to see what it is that we're treating. And just, I can treat all different races and ethnicities. So it really, age-wise and ethnicity is not a problem. So don't be scared to come and see me.
But I think that's really important, because people, they try all sorts of home remedies.
Yeah.
How do you feel about some of those ones that we hear out there?
Yes.
I know, it's not everyone can afford to go to a clinic.
Yes.
So what do you suggest to people out there? Should they be using soap? It's just all about treating it.
Yes. People that use soap are usually those people that can get away with using soap, that don't have very many flaws. So really, it's best to come and see a professional, just because prescription-based skincare is going to correct the problem.
That's what I was trying to get to.
And it's going to correct. And really, don't be afraid of the pricing and everything. We have so many products that help so much, and they are about the same price as what you can get as over-the-counter, but it has medicine in it.
And that's what I want everyone to know as well, is that it's okay to self-diagnose, but sometimes you could actually be making it worse.
Yes, very much so.
As you said, free consultation. First step, everyone, free for the consultation. Then what? You do the diagnosis, and then you come up with a treatment plan.
I do.
Let us know a little bit about some of the treatment plans that you have.
Most of them, you need at least 3 or 4 treatments at least.
Okay.
So you're going to just have to be open-minded about that a little bit when you come in. But we do everything from chemical peels to laser, which are probably my 2 main go-tos for breakout-prone skin. So heat with laser really kills that bacteria, and chemical peels, which are very non-invasive, little to no downtime nowadays, they really get the debris out of the pore. So you're really treating from that core of the pore coming out, which is how you want to treat it, because you don't want to keep just putting stuff on your skin that's sitting there.
And clogging it up.
Yes.
You said sometimes 3 to 4 treatments. Is that the same for most people, or that's on average?
That's really the same for most people.
Okay.
You're going to just get a better result after 3 to 4 treatments.
And when you have those treatments, would you take skincare home to treat it at home as well?
Right. Your skincare is kind of like your insurance for what you have paid for.
Yeah.
If you go home and you use, this, that, and the other on your skin, you could be then exacerbating it.
You're right.
So, really to be on a good regimen that I create for you or a nurse
just
practitioner creates
helps.
for you, it's going to make everything go further.
All right, we have a promotion for all those teenagers and young adults out there. Tell us a little bit about Resurfix.
So Resurfix is our non-ablative Fraxel treatment, so it has little to no downtime. It is great for acne and acne scarring. So we have the $100 off right now.
Okay, so all you have to do is call that number, everyone, 502-868-0806. We really appreciate you being with us today, Miss Ellison.
Thank
As
you.
always, good
Thank
information,
you.
Ellen. Back after this short break, you're watching Midday Kentucky.